Well, this month is National Suicide Prevention Month, a time set aside to raise awareness and spread the word in an effort to reach out to those who may be struggling. Joining us this morning with some important information on the topic is Cicely Brooks, the Site Director for the Crisis Stabilization Unit. And Cicely, it's good to have you on the show.
Thank you for having me.
Well, you guys have been around for several years now, right here in Johnson City.
Yes.
Tell me a little bit about the facility and what you guys have.
We are a facility where people come in if they've been experiencing suicidal ideation, any form of mental illness, and they come in and we treat them for 3 to 5 days.
And you said this is something that really the whole family needs to surround them with their support when someone is going through these tendencies.
Absolutely. Family is key to the success of someone in recovery.
And one of the big problems when it comes to suicide is the stigma that's attached. Nobody wants to admit that they are having these thoughts. And you said that just compounds the problem.
Absolutely. It's really important that we all talk about suicide. This is a very important issue for our society. Suicide is now the 10th leading cause of death in our country and our state.
10th leading cause of death,
Yes.
and completely preventable if we can just reach those people before it's too late.
Absolutely.
Tell me a little bit about the Zero Suicide Initiative that's been launched.
Okay, well, in 2012, the Action Alliance for Suicide Prevention developed the Zero Suicide Movement. And the state of Tennessee has adopted this, and specifically Frontier Health has developed a Zero Suicide Committee. And in this committee, one of the things that we've done is we're training 100% of our staff in Question, Persuade, Refer, which is called QPR. And this is designed to help anyone, regardless of education, be cognizant of the warning signs, behaviors of someone who may be experiencing suicidal ideation.
And you said, too, there are people and groups of people that are at a higher risk for suicide.
Absolutely. White males over the age of 65 are 2 to 4 times more likely than the general population. Our veterans and active service members are 2 to 4 times more likely. Our seriously mentally ill, they're 6 to 12 times more likely, and our LGBT youth are 2 to 3 times more likely to actually complete suicide than their peers.
So what are the warning signs? What are some of the things that we need to be looking for that might say a friend or a family member might be having these thoughts?
Okay, well, if someone is actively talking about wanting to die, if they are looking for ways to die, if someone is hopeless, depressed, isolating, if they've been using alcohol or drugs excessively, those are some significant warning signs that maybe this person needs intervention immediately.
And certainly the community is there. You guys are there to sort of walk them through that process and to make sure that they get the help that they need. Okay. And this is a perfect month that you said to sort of raise awareness and let people know about the resources that are right here in our community, and so important to reach out if you think there's even a thought process going on.
Exactly.
Okay. Well, we want to give everybody the phone number and the website. If you need some help or if you know somebody that does, you can make that call. It's a very important call and it could definitely save a life. Cicely, great to have you on the show.
All right. Thank you.
Also want to let you know there is a walk coming up. It is a memorial walk September 27th. It begins at 4 o'clock at Warriors Pass State Park. For more information, you can also check out that website. We're back with more of Daytime right after this.